Hello, and welcome back to Panama for Real. Today, we're continuing our series of programs that demystify the process of relocating to Panama. And one of the topics that's always top of the list of people's questions is the health system here. Today, we're very lucky to be joined by Dr. Pablo Noel, who's one of Panama's foremost doctors. He's a dermatologist, but also has vast experience of internal medicine. Dr. Noel, thank you very much for joining us today.
Thank you so much for inviting me, and it's a pleasure to be here and provide all the information necessary, as you said, to demystify all of this process, help people to come here in Panama and enjoy it.
Yes, it's and health is obviously for a lot of people very important, and every country has its own health
Right?
system. Could you give us an overview of how the health system here in Panama works?
Yes, of course. The Panama health system is divided in three forms or three systems, you might say. The first, the first one is the most basic one. It's a public system that anyone could access to it. It doesn't have, you don't have to be a resident or a Panamanian. You could be a foreigner, and the doors are open, and it's provided in all its extension of health necessities. Um, the good thing about this is it's throughout the country. You can find a hospital almost everywhere. The downside of it, it's that it's very crowded. Is there normally it's very saturated because the demands are a lot, and the offers that we give are not so many for the amount of people. So the obviously one of the advantages is the price. I mean, the price is very low. We're talking about $1 for a consultation, maybe $15 to $50 for a not I mean a minor surgery, maybe $100 for a major surgery. So it's very cheap in the costs, but it's very saturated. Um, what I would never recommend going to this public system if you're just going to consult for, like, for example, a routinary checkup or a disease checkup or disease follow up. What I would recommend this system is for example, a trauma. If you have a like a car accident, right, or car crash or something related to trauma, is the best, maybe one of the best equipped health systems because it's very used to this type of scenarios. Is prepared, it's ready for that, so it doesn't depend on the amount of people waiting. If your trauma is considered major or needs to be evaluated as soon as possible, you will get that attention as soon as possible, and with the best trauma surgeons in the country. So it's pretty good when you're looking for that.
That's
And
good. That's very good to hear.
yes, and like if you are unconscious, um, if you get unconscious because of an accident or whatever, probably they'll take you there, right? Because that's where they know you get the best attention. Um, the other health system is the semi-private, semi-public system, known as the Social Security health system. So everyone in it has to be a official part of the labor class or the labor group of the country. Everybody that is working actively in the country must have a social security access to this system. It's more of a more. It's not that saturated. It's actually bigger than the public system, but it's only the service is only given to those who has the social security number or social security. They're paying social securities, as we say. So if you're working in Panama, you might have access to this one. The advantages, obviously, you don't have to pay anything because you're already paying in your social security every month. They take from your paycheck, but you get pretty well attention. It is saturated as the other one, not that much, but it's a little bit slow. But you could actually access to everything related to health from a very normal health checkup to a heart or kidney transplant. So it's very broad in all of that it offers. The third health system is the private health system, which is not that big. It's not as big as the public or the social security, but one of the advantages is that it's very easy to access. Obviously, if you can pay the money, you can access it pretty quickly, right? So it's very advanced in all of technology, and the hospital are very well equipped for any health concern related to from trauma, for example, or a minor surgery or a major surgery, like, for example, a cancer treatment surgery or any treatment that you might be thinking right now. We actually have it here. It's pretty well known, but it's pretty expensive, right? So it depends on the amount of how much you have to access to it.
Sure. So what's the average consultation fee for a specialist here? Not for something serious like cancer, for other types of illnesses.
Well, we have, well, if we go to the epidemiology statistics, we could say that more of the things that we see are upper respiratory conditions, uh, infections. Most of these are maybe the main concern or condition people go to the hospitals. Um, but related to the foreigners, what I would say that one of the questions I get asked a lot, if you need a consultation for a specialist, like me, for example, you need to be first evaluated for a family doctor or a general practitioner, so it can be referenced to the specialist. Well, that is the case in the general public hospitals and in the social security. The only exception to that rule, if you come with an emergency. If you come with an emergency and you're evaluated in the emergency room, and you need a specialist evaluation, you will get that as soon as possible. In the private sector, you can go directly to the specialist. You can actually call the specialist office and ask for for an appointment, and you will just go directly, and you don't need a intermediate doctor to get that. So that's very good in the sense that it's very fast. But again, it depends on you have to pay for it. So that could be a concern, and a lot of people ask, the question that's going to follow up is, how can I access the private sector? I mean, other than having the money to pay for it, I will talk a little bit about the prices. You'll know how much are we talking about. But if you have a private insurance in where you live, or international insurance, you surely can use it here. So that's a good thing. A lot of hospitals and a lot of doctors from the private sector are affiliated to international health insurance. So you might have to ask your insurance to tell you which hospital you have to access to, and they will have an office there that could guide you or make the appointments for you if you need evaluation for a dermatologist. Because I actually work for one, so I know that normally they call me for a patient that is a foreigner from Canada, from the States, and needs an evaluation. So they'll call me, they make the appointment for the patient. They just got to come to the appointment. So that's one thing. The other question is, well, can I get a new insurance in Panama? Well, there are some options you can apply to. It depends on what are your if you're a resident or you're just going to stay for a tourist or you're just going to stay for a few months. It depends on that. There's the main health insurance companies that they will cover you, depending on your condition, on your situation in Panama. And we have some hospitals that bring a very basic but very useful insurance that you pay every month, and they will assure you that you will have the attention you need on the basics that you are insured for. And the last one is, well, I don't have an insurance. I don't have a international insurance. I'm not going to stay in Panama. I don't know. I don't know if I'm going to stay or not. But I need a doctor. So where can I access, and how much I have to pay for it, right? So the answer there is you actually can access. It's very easy. You can find us everywhere. Social media or just a telephone guide or um, through the other clinics and hospitals, and the amount, the average cost for a family doctor or a general practitioner, it's around $30 to $40. 30, 35, most of them. A lot of them. It's around that price. For a specialist, like specialist consult will go around $70 to $100. Something around that. And like for a minor surgery, like a I don't know, just like you need something removed, that you could do it by local anesthesia. It will cost you around maybe $200, $500 tops, right? It depends, obviously, on the type of surgery, but it doesn't go far from that. If you need a major surgery, I'm talking about a spine surgery or a neurosurgeon type of surgery, it will cost you around $30,000, something like that, 20 or $30,000 for the whole thing, not only for the surgeon per se, but the whole hospitalization, the surgery room, the anesthesiologist, and so on. So it's money. It's a lot of money, anyways. But at least we could find the ways to help you here. There's a lot of options. I will say, don't get with the last one. Try to see if there's something you could apply for and be covered by, and I think that will be the best wise decision if you come to Panama. Remember, if you have a trauma, you don't know where to go, you are anxious, please consider the public system if you have this condition and you need an evaluation as soon as possible, right? If it's more of a disease that you don't know the symptoms pretty well, maybe a pulmonary condition, a heart condition, I would recommend first go to the private sector, get evaluation by the specialist as soon as possible, and he will guide you to see which are the options for you.
Okay, that is incredibly detailed, and I've learned a lot today from talking to you, Dr. Noel. Absolutely fantastic. Thank you very much for your time, and I look forward to seeing you soon in another episode.
Thank you, Mr. Moran.
You're welcome. You're welcome.